LA County has been the center of the surge in the state.
And tonight, strong warnings from health leaders as area hospitals reach the brink. LA County just released its extremely high numbers, 14,418 new cases, another 102 deaths, and more than 4,800 people in the hospital. Riverside County is nearing 133,000 confirmed cases and reported 42 new deaths just today. San Bernardino County is approaching 14,500 confirmed cases with more than 9,300 new infections, and 19 more people have died there. Orange County reported more than 2,600 new cases. 13 more people have died after contracting coronavirus. Ventura County had 730 new confirmed infections and 3 new deaths.
And CBS 2's Amy Johnson tells you what county health leaders are saying right now about the crush of cases.
The LA County Department of Health says there are still some ICU beds available. Today, 92 of them. That's 10 less than yesterday. And with the cases surging, that number could drop even more. As COVID cases surge, the number of available ICU beds has plummeted. The state map shows there are 0 beds available.
What we hear from some of our hospital partners is that many of them are making adjustments in terms of whether or not elective procedures are being done in their facilities. Many of them are also implementing their surge plans in order to take on more patients and trying to increase staffing.
LA County Public Health Officer Dr. Muntu Davis went on to say that choices are being made at each hospital to care for patients, though he couldn't speak about the specifics, but he says they get help from the state.
The state has developed over many years, a group to look at what it may mean to think about making choices about how you utilize scarce resources.
He says it's similar to deciding who will get the vaccine first, but that everyone will eventually get it.
Providers are very good at thinking about and making assessments on patients on whether or not they should be in the hospital or not, as well as in terms of when they should be transferred out. And so the system will have to make adjustments and work through that. But I trust our healthcare providers to think through what's best, for their patients, given what they have in front of them.
Dr. Davis and the other doctors on the panel say the biggest choices are ours, and whether or not we choose to follow the guidelines to stay at home and only leave for essentials, and whether or not we wear a mask and keep social distancing. I'll send it back to you.